Hello, my name is Abby Hills. I'm a graduate student in the Nurse Educator track at Elms College. Today, I will present the workshop I've developed as part of my graduate capstone project entitled Improving Nursing Faculty Competencies in the Use of the Clinical Simulation Laboratory. The use of simulation-based learning in clinical nursing education has increased over recent years. However, the confidence and competence of nursing instructors utilizing this equipment and the evaluation of the effectiveness of such instruction is less clear. Historically, the aeronautics and defense industries, as well as medical schools, have utilized simulation-based learning rooted in the principles of improvement of safety and competency. Accordingly, this methodology in clinical nursing education provides the nursing student with replication of real-life patient experiences through a hands-on interactive learning methodology, promoting nursing students to collaborate as a team in a safe, controlled environment to solve problems through critical thinking. Additionally, the debriefing process, which follows the simulated-based learning experience, effectively assists the learner in a guided reflection exercise leading to the processing and understanding of the simulated clinical experience. As the utilization of clinical simulation in undergraduate nursing education increases, it is imperative institutions of nursing education move forward with training the trainer for this paradigm shift. As nurses, we are quite aware the 21st century has brought enormous changes to this nation's healthcare environment. Nursing education and the nursing profession in general have undergone a tremendous metamorphosis, with shifts in patient acuity levels, shortened lengths of hospital stay, increased nurse responsibilities, the boom of informational and medical technologies, decreased availability of traditional clinical sites, as well as nurse and nurse educator shortages have led to an increased dependence on adjunct nursing faculty. Compounding this issue, typically, adjunct nursing faculty have limited experience in the educator role, often with minimal orientation as well as limited experience in simulation-based learning as a methodology of teaching nursing students. With that said, the utilization of adjunct nursing faculty is and will continue to escalate, leaving the remaining question of how then do nursing institutions successfully train the trainer for clinical simulation in nursing education. The objectives for this project are to provide an easily accessible, portable, quality improvement workshop that promotes nursing faculty preparedness in the clinical simulation laboratory, thereby promoting increased confidence, competence, and effectiveness of the adjunct nurse faculty utilizing this specialized environment. The significance and relevance to institutions of nursing education include the decreasing availability of traditional clinical sites for nursing students, nurse and nurse faculty shortages in concert with the myriad of changes within the healthcare system, as well as nursing education. It is incumbent on institutions of nursing education to meet these challenges and implement strategies in order to develop an effective praxis or fusing of nursing theory and practice. Typically, adjunct faculty possess limited experience not only as educators, but as well limited experience in the clinical simulation modalities. Literature consistently stresses the need for specialized faculty preparation in this paradigm shift from traditional clinical to simulated clinical settings. For decades, simulation has been used to reduce human error and build effective teamwork in the aeronautics and military training. By reducing overall error rates as a result of failures in communication, collaboration, problem solving, and management of workloads. These principal lessons carried over into the preparation of nurse faculty in the clinical simulation-based experience, utilized in concert with CUSIN competencies, clearly lays the foundation for an effective preparation of nurse faculty in this paradigm shift. Moreover, the incorporation of CUSIN competencies of quality improvement, informatics in teaching, safety, patient-centered care, evidence-based practice, and teamwork and collaboration drive the answer to why simulation? Again, diminishing availability of traditional clinical sites, the goal of reducing human error and improving patient safety through the increased skill development with on-demand access to simulated patients drives the paradigm shift from traditional to simulated-based clinical experiences. Simulation-based learning affords the student nurse with on-demand access to patients, allowing for scheduled and programmed learning experiences to meet specific learning objectives set forth in the nursing education curriculum, thereby affording multiple learning strategies, immediate feedback, and defined learning outcomes and measures. SimMan can be portrayed as acutely or chronically ill, as well as a healthy patient, providing the student nurse with interactive experiences leading to the development of communication skills, assessment and decision making, hemodynamic monitoring, and professionalism. As well, the integration of props, scenarios, and role play increase the realism of these learning exercises. In instructor-led groups, each student is assigned a specific role: an RN, student nurse, and family member or scribe. Generally, scenarios are run in groups of 2 to 3 students, while the remainder of the class observe via video feed in real time their peers, vicariously learning while evaluating using standardized checklists of key performance indicators. And finally, often referred to as the heart and soul of the clinical simulation learning experience, is the debriefing process, with the entire student group immediately following the simulated exercise. During the development stages of my capstone project, it was identified there was a need for an updated or adapted version of the existing black and white user guide for faculty in the use of the simulation laboratory. With that in mind, I adapted and developed from the existing user guide a detailed color photo user-friendly guide for nursing faculty on the operation of the simulation laboratory. Utilizing this guide, we will now explore the basics of the simulation lab and equipment as demonstrated in the next few slides. Welcome to the Clinical Simulation Laboratory. This is the SimMan compressor and link box. Begin by turning the switch located on the back of the link box to the on setting. A red light will appear on the front of the link box. This indicates it is functioning. The SimMan monitor is located to the right of SimMan's head of the bed and is turned on by pressing the power button as indicated. Then entering the control room, we have the audio mixer. Turn the switch on the back of the unit to the on position. The unit is on when the green numbers on the upper right-hand corner appear. Next, boot up the server by pressing the power button. Then select on the computer screen the AVS server icon as indicated. Select the Laerdal video server icon, and your computer screen will now provide you with views of the simulation room. The wall unit above the patient bed runs on an independent compressor called the SIL-Air. This allows the student the opportunity to practice in real time skills such as suctioning, application, and manipulation of oxygen, just as the wall units in the hospital settings would. To turn on the wall unit compressor, flip the switch on the top of the unit just inside the case as indicated to the on position. Next, you will need to turn on the laptop and select the SimMan icon from the desktop as shown here. Then select Sim for the login. You do not need to enter a password. Next, select Finish at the Edit User screen. You must begin the Start Video stream on the computer before proceeding on the laptop if you wish to record the simulation session. Now select Yes on the laptop pop-up if you choose to record the session, otherwise select No. This is the SimMan graphic user interface, which allows the instructor the capabilities to change the simulator settings to reinforce learning areas including physiology, pathophysiology, and pharmacology. At the top of the screen, select Edit Microphone Configuration and check the Microphone On box. At the bottom of the screen, select the audio icon and uncheck the mute box. Turning on SimMan's compressor, set the power switch to the off position, close the drain valve, air valve, and CO2 valve. Now push the power switch to the on position. The compressor will run for about 45 seconds to build up pressure in the tank. When the compressor stops, open the air valve. Check to make sure SimMan's chest is rising. If not, give him a gentle shake to wake him up. You are now ready to run your simulation scenario. To turn off the compressor, push the power switch to off, close the air valve and CO2 valve, open the drain valve and drain the air out of the system. Over the next few slides, we will explore the debriefing process. Facilitated by the instructor, this exercise promotes feedback to the student group, while positive aspects of the completed simulation are discussed and reflective thinking and learning promote the nursing students to link the theory of practice and research while thinking critically and discuss how to intervene professionally in clinical situations. It is important to create a non-threatening, safe, confidential environment utilizing a circular seating formation with all participants as well as the instructor at eye level. This exercise as well provides the students with practice in peer review and development of constructive criticism skills. The next few shots are still shots that are taken from an actual video debriefing exercise which I led with 4 Elms nursing students. Again, the importance of timing is crucial. Conducting debriefing immediately following the simulation exercise while the students' thoughts and emotions are fresh and present. Utilizing this time for discussion and analysis of events and the transfer of knowledge with structured questions. How would you say the exercise went? What would you say went well? What could you do differently going forward? And finally, what skill did you learn today that you can take forward into your nursing practice? A link to view the debriefing exercise in its entirety will be provided. I'd like to take this opportunity to say that these 4 young women volunteered to participate in this debriefing session as part of my project. The video is in real time and it is not scripted. So in conclusion, clinical simulation in nursing education is a distinct paradigm shift. It requires specialized faculty training and is recognized as a priority level issue in the preparation of advanced prepared nurse educators. It is the intention of this project to provide adjunct clinical nursing faculty with a didactic, effective, easily accessible resource to improve nursing faculty competence in the use of this specialized environment of the clinical simulation laboratory. The healthcare environment of the 21st century is constantly evolving and moving forward. It is my hope that this workshop, user guide, and debriefing video will provide adjunct faculty with the resources and tools to be active change agents in the quest of nursing education excellence. Thank you.